Episode 2, welcome back to the RMC podcast. We're starting out with a little icebreaker. What's your biggest pet peeve at your practice?
At the practice, man, I would say during the winter months, I should probably put some signage up about this, but salt kind of gets tracked into the clinic room, and
You learn it.
salt and rubber, not so good mix, so it's definitely
It's
important for me.
Yeah, that's an annoying part of the winter. I wouldn't call that like pet peeve. For me, I have these wobble discs in my office. They're like blue discs you sit on, and not everyone uses them because not everyone needs to use them. But people will put them on the ground, and then when they leave, they just leave them on the floor. And just they're everywhere. Sometimes they're on a desk or
So
whatever.
you're going to bend over and pick it up.
Yeah, and it's just like I'm walking around throughout the day, just putting these things back on the chairs.
You don't just like quick try them out before you put them back?
Every single time.
Yeah.
I mean, just to check if they're flat.
Do you know how balanced you can be?
That would be very nice. That's
You
very
know you could just get a big exercise ball and replace all the chairs in the lobby and make people sit on those. And then you don't have to pick anything up.
That wouldn't work for the 80-year-old people. They wouldn't be very happy with that.
Fair enough. Longevity of life. It's all in the cold.
That's very true.
So
Very
it's a win.
Right.
Biggest pet peeve? I got too many. I'd say number one is definitely being on time. But that's why you roll the dice. That's the reason.
Like clients being on time?
Clients being on time. I mean, this morning I showed up 7 minutes before class and I was late in my book.
Yeah.
I was stressed out. That ruined my whole day. I forgot my shorts. I didn't make my coffee. All that. Pissed. So
Good thing there's traffic to slow us down. Because I think everybody
there was 6 people this morning that were late. Yeah. So,
You're one of them.
I only had to do one burpee though. I got lucky.
Yeah, I saw that.
nice for you.
It was good.
If you weren't here last time, I'm Mitchell. I'm the owner of CrossFit Woolly Mammoth here in Mequon. To my left,
I'm Dr. Garrett Panno, Clinic Director of Chiropractic Company in Mequon.
And I'm Dr. Sam Zehnder, owner of Rock Solid Physical Therapy, also in Mequon.
so a common theme here is we are in Mequon. It's huge.
That's the game.
That's the theme.
Mr. Gary, why don't you lead us off? Heard you had the gist for today.
So today we're talking about misconceptions in our own practices, right? You know, chiropractic practice, physical therapy practice, and as a CrossFit gym owner, your movement practice, right? And just how you lead our community. So with that, you know, I'll kind of start, I suppose, with misconceptions. You know, I almost frame it in the way of people when they're new to the office will have more misconceptions because they don't know any better, right? And so when people are new, in general, the 3 things they want to know is, can you help? You know, how long is it going to take, and how much is it going to cost? And so but for that second point, how long is it going to take? The misconception about chiropractic care is that once you start going, you have to go forever. But for me, the reality is I want to make a plan with somebody, and whatever that person wants to do is what I want to do. So whether it is an acute injury and that's what all they want to take care of, let's take care of it. You know, and that could be a couple of visits, that could be, you know, an extended, you know, couple of weeks or something like that, and then that's it. If we present different options and they want to be more proactive, great. But just, you know, like going to the dentist, you know, every couple of months you go, you know, doesn't mean you don't take care of your teeth, kind of thing. So that's probably one of the biggest misconceptions of chiropractic practice.
Do you get pushback on that much from like new clients? Do they say like, oh, I think this will help, but I'm not, you know, bought into continuing to come back, or I don't really, you know, want to get sucked into it? Like, does that happen a lot?
I would say when I have not been a great communicator and people feeling comfortable to actually talk to me, then there's pushback, you know, like what our actual goal is. If somebody just falls off the schedule and doesn't come back, it's a clear indication that myself as their provider and them for their care wasn't aligned, compared to them feel comfortable, like, no, like, just, you know, my last patient I saw before recording this, it's like, I'm just here for about 3 to 5 visits because I just want to decrease my pain just enough. Okay, great, very straightforward. So I think it's about establishing that enough trust so you can clearly communicate about that stuff.
Yeah.
So what do you about you in that?
Oh man, I would say there's quite a few. Honestly, some of them I think are fair, like maybe some of the criticisms of physical therapy, but to not take up the entire time here, I'd say probably the biggest one is that we are more like technicians. Like, you know, when you go through physical therapy, the physician or whoever maybe referred you there, if you did have a referral, is really in charge, and the physical therapist is just kind of there to go through the cookie cutter emotions, which to some extent is fair because that's kind of how our profession is rooted. We initially started as what were called reconstruction aides back in World War I. We were essentially just technicians that did what the doctor told us, but we've gotten to the point now where we have the doctoral degree and I have some of that autonomy, but a lot of times it's looked at as more of just like an adjunct service, not like its own discipline. But again, I think part of that is our own fault because as PTs we should probably market ourselves a little bit differently and give people the autonomy to say like, yeah, if this isn't working, we don't have to just keep going through it. Just because your doctor said you should try it doesn't mean you're stuck in it forever type thing. Conversely, if you feel like it is helping, like yeah, let's make our own decisions versus just doing what like the script tells us we have to do or like what's traditional. So that's probably the most obvious one, I would say.
Well, and then on the flip, a lot of people, they're like, I don't need it, I know what I'm doing. Yeah. I mean, from my perspective, right, like well, do you even go back before college, it's like, oh, you're going to school to be a PT. It's like, no, I'm not, I'm a strength conditioning specialist. Like that is the goal of what I'm trying to achieve. So it's like the longevity of something, that's not, hey, I'll see you in a couple of weeks, or it's like, we want to see you every day, make sure that you're moving properly, that you can take what you learn from the standpoint of XYZ with some basic equipment, do the exact same thing out in the real world and not feel hurt ever. So, I mean, that's the big thing that I think about. So, it's different. But.
So what would you say like the biggest misconception is for you in the CrossFit realm based on what you just described?
In the CrossFit realm, it's weird because everybody's like, oh, this is too intense and I can't do it, I'm not fit enough yet. And the crazy thing is it's for everybody. So we have here in our community specifically, we have anybody from 16 all the way up to our oldest athlete being 70, right? So all of which are coming to the same exact class, maybe not at the same hour of the day, but everybody can do it as long as you're willing to try. And that's something that we kind of touched on last time, right? That willingness to be able to understand. And I think that just goes for everybody's practice, right? Like you gotta be willing to let somebody touch you and move your neck around to an adjustment point. You got to be able to take somebody's information and say, hey, like, yeah, it's not going to happen with the snap of the fingers, but you're going to be able to get there in a couple more times that you come and see me, as well as you doing the opportunity, the stuff that I'm giving you outside of the clinic. Like, people always just want that one-stop shop. Like, hey, I'm going to start taking Ozempic and I'm going to lose 200 pounds. Good luck.
Yeah, but I think what's cool about like having a partnership like we all have is that we have the opportunity to shed light on each other's professions to our clients. Like I've had many clients that have said like to me, oh, you do CrossFit? I thought that was bad for you. Or like, I don't want to go see the chiropractor because I don't want to get my neck cranked. And it's like, no, like, there's much more to each of those than you think. And I think it helps a lot for folks to hear that from providers outside of that domain, because obviously if a CrossFit coach is telling you like, hey, CrossFit's for everyone. For some people, they put up the defensive walls a little bit. Same thing with chiropractors, same thing with PT. But if now other providers are saying it, now it's like, oh, okay, maybe there is something to this, I should listen. So like to have this kind of partnership, I think is powerful for that reason.
It's a title. It's like we got to just break the barrier of exactly what it is and what it stands for everybody. I feel like if people had an understanding of what we learn in school, what we're trying to preach, I mean, I didn't know that was a World War I thing.
Yeah,
right?
yeah,
like,
that
why.
surprised me.
I never would have thought that.
Yeah, I mean, we're super young as far as healthcare is concerned. Physicians have been around for, a couple thousand years now, and PT is about 100 years old just about. So
did it start like as a profession in World War I? When did?
Essentially, yeah. So the title we had were reconstruction aides, and it's kind of interesting how it's evolved. I believe at that time it was primarily women. Obviously, all the men were out in the war. And it still is slightly female dominated, but over time that's kind of shifted. So obviously men are getting more involved, but a lot of fields go through that, like physicians now, there's many more female doctors too in the workforce. Just over time, right, things evolve and things change, which is kind of cool. But as far as PTs go, yeah, we were reconstruction aides, so essentially we were like kind of, I guess, nurses, you would say. We were bedside, but even probably underneath that, as far as our autonomy, we're just technicians, do exactly what you're told. And then that evolved into its own thing, and we obviously then start to focus on mobility and exercise and branch out into everything else we can do now. So
I'm only going to say this because it goes with your name, not the reasoning behind your name, which we talked about last time. But as rock solid, you should be Doctor of Reconstruction Aid. That just sounds like that fits.
That would work.
That's pretty cool, too.
Yeah,
I mean,
that sounds.
give homage to something that happened so long.
I might have to expand my business card.
You're gonna need a full sheet of paper.
Shrink the font size.
Yeah.
I mean, do you know when chiropractic started then?
It was in the 1800s in Davenport, Iowa. But there was.
I'm from there. That's not relevant. Keep going.
Are you actually from Davenport?
Yeah, I was born there.
Oh, snap. I didn't even know that. But, yeah, Quad Cities. So you're familiar with Palmer's campus
Yeah.
and all that kind of stuff. But there's, documents kind of bone setters, throughout history. But as a profession, the profession started somewhere in the 1800s and really developed, near the late 1800s, in terms of our autonomy and what a chiropractor can do and can't do and all those definitions. But like you can go to ancient China and like a bone setter in ancient China could be arguably a very pre-early chiropractor without knowing what we were doing as a
That's wild.
profession.
I guess that's why I don't have a doctorate, because it's only been a thing since the 80s.
Yeah.
Yeah, it started in Nebraska.
Yeah.
And Nebraska University was the first actual strength conditioning coach.
Mm-hmm.
And then obviously from a CrossFit standpoint, it started in like early 2000s.
Sounds
So,
right.
I mean, it's a baby,
Yeah.
right? So a lot of knowledge, but a lot of people think that they know best, but you just gotta pair up and find the right one.
What's your favorite misconception to educate people on about your facility?
Walk in the door. Don't be afraid of the loud music and the people that are sweating. That's something that they freak out about. Like, you're here to work, you're gonna sweat. So
So people are afraid to like the loud music and the sweat.
I think that one, from the male side of things, in a CrossFit gym there is a very big there's a fine line of how much clothing you wear, right? And sometimes people look at that and they're like, I definitely don't want to go. It's because it's an intimidation factor, right? But it doesn't matter. Like, just if you don't feel comfortable, hey, maybe you'll get to that point and you want to feel comfortable. Take your shirt off during a workout. But yeah, I think that's probably a small thing that people shy away from between the music and the individuals that are sweating their bag off. But nothing too crazy.
I think it's like anything in life. A lot of people in general are just intimidated by hard things, challenging things, and that can give off the vibe of, oh, that's maybe beyond what I'm capable of. But part of what I love about the gym here that you've made is that it is that welcoming environment. That, yeah, the music's loud, people are sweating, but nobody's gonna talk down to you or make you feel like you're less than or you don't deserve to be here.
Unless you want that.
Well, some people do. I don't know.
That's awesome.
But no, it's great. Like you said, it's for everybody. And like, okay, maybe you're not familiar with some of the movements, but like you stick to it for a couple of weeks, and then things start to kick in, and you form relationships, and then it's like you forgot it was ever challenging.
Yeah,
So
it's just something fun. I mean, that's another thing too. It's a damn fruit fly there. The other thing that I'd say that is misconstrued is the fact of the intensity part. That's when people start to freak out, right? High intensity has been a thing in the fitness realm for so long, and when people look at the word CrossFit and they're like, oh, that's too intense for me, because we take every modality of fitness and morph it into one, they don't want to do that. So it's just, hey, try it, you can do it, we'll scale things back accordingly based on your abilities, and then from there you're going to gradually make it harder, but as you start getting better at it, it's going to become easier, and that's just it. So it takes time. It takes just the attempts and the
Well,
repetitions.
the scaling the intensity, if you're going to a CrossFit class, is how I visualize it is a pedal, right?
Absolutely.
If you know all the movements and you're healthy and good to go, you're gonna, when it says as many reps and rounds as possible, that means pedal to the metal. But if you got something going on, or like even this week a little bit and last week, I personally was trying to like hold back about 30%, just to give my body some chance to heal and rest.
But why was that?
Well, let me finish the point first.
classic.
But, in my mind, I knew I could go harder, but you can breathe through the movements. You don't always have to have your heart rate at 180, 175, whatever your max heart rate is during the whole point, and you can go through the movement at the pace that you feel comfortable with, and and still have a really good stimulus base because your program is always right on the money for that.
I mean, it comes down to just going to the right person, right? That's why the three of us work together so well, is because we're trying to we all have the right mindset and the same ideas that we're trying to achieve for anybody that's working with us. And when you find a facility that is like that, they're not going to steer you wrong and just say, hey, you're free, go do what you want. And then that's when people get hurt and gives us, as the industry of CrossFit, such a bad rep. And then you hear chiropractors say, oh, there's a new gym that just opened up, this is going to be great for my business. Or a physical therapist says the same thing. It's like, let's go. It's like, no. The preventative care that we're doing, it's, hey, let's reach out to something's bugging you that could be an underlying issue from outside of the scope of that hour that I see you compared to the 18 other that you might be moving like garbage. Hey, it's probably from that, unfortunately. Let's go seek out help from our friends over at Chiropractic Company and Rock Mammoth. It's just how it should be. So
I think along those lines, though, you should explain a little bit about like the methodology behind CrossFit, because I've had quite a few clients that will say things like, "Oh, that's it just looks like it's random, right? Like you're just kind of throwing weights around," and they'll use that word random, but variable, right, would be the definition. But you're obviously more the expert there.
yeah,
like
so
there's structure to it.
The definition of CrossFit is constantly varied functional movements executed at high intensities, right? So you break it down in those three parts. Easy thing that everybody focuses on is that intensity. High intensity, okay, so my heart rate is gonna get jacked up. No, that's how much you're going to throttle forward or throttle back, right? Constantly varied, that's just a random portion, but you take it into the terms of, hey, today we are going to do a push movement. It's going to look like a back squat today. Tomorrow we're gonna do a pull movement. That could be a deadlift. And then you come back at another day and it's another push movement, and then it's a bench press. And then again, we'll go with a pull movement and we're doing a pull-up. And you just vary that through, but you keep the consistency of, hey, push, pull, strength, or endurance, and then you roll with an idea of, hey, let's go high skill versus low skill, and that's what makes up all the fun part of making CrossFit what it is, which is taking gymnastics, powerlifting, Olympic weightlifting, your metabolic conditioning, and smacking it together and just being creative and having an art form to be able to do it. So,
because this is your first CrossFit facility you've been a part of, correct?
Yep.
And mine as well. So, as a practitioner,
well, you've been a part of a couple places and dropped in places. So, like, you've seen how other facilities do it. And that's another thing that's cool, too, because you're not going to get the same thing at every spot.
Well, that's what I was kind of just to your credit. I mean, I've only been a member,
Okay.
or like really committed at your facility. And so, like, how you program start and stop and how you do your blocks and how you think through, seems to be very thought. There's a lot of thought that goes into each day, each week, building up, pre-test, post-test. And so if he was just coming in and just doing different movements, that's completely different than this is the goal, we're gonna pre-test it here, and then we're gonna build up to it and do all those things that you've mentioned. That's not random by any means. That's a different way of going about your training.
Well, and then a big thing too that in the definition, or I shouldn't say in the definition, but in like the words of fitness itself, we try to stay away from linear activity, because that common, consistent, repetitive activity is going to be the issue. Because then what happens in daily life? You get into a rut, you don't want to do it, you get bored, you stop doing it completely, and then you fall back out of that fit health continuum, right? And that's what's in essence going to drive us into obesity or chronic disease or all these other things. So, I mean,
I think that point on structure though is great, really for all of us. I mean, anytime you're working with a coach or chiropractor or PT, like you need to have that structure, that plan. I think that's, at least speaking for physical therapy, another maybe misconception, and probably it's fair to some extent, is that the exercises or the interventions do just kind of seem haphazard. Like you're just saying, oh, if something hurts, let's stick a needle in it, or let's maybe squeeze your butt a little bit, see if that makes the pain go away. But
learn to breathe a little differently.
yeah, but it's like you have to be able to like take measurements, and then like your provider needs to be able to like set up a plan for you. Like, okay, this is why we're doing it this way, and we constantly reassess, just like we reassess after 6 to 8 weeks or whatever the block period is. Like, you have to have that structure, because otherwise, like you said, you just get stuck in this rut of like, I just go to the gym 3 days a week and I do curls and bench and squat, and then I just go home, and it's just rote activity over and over again. You lose focus, and you don't even know if you're actually even doing anything positive for your health. So like, you need that structure for sure.
Yeah. So circling back, do you guys have, like, I know it's different for every person, but is there a minimum or a maximum amount of times that you would rather touch or see somebody that could change the outlook on how fast they get back to play or doing what they're doing or just moving without pain?
It depends on the condition, and it's very individualized on what they got going on for sure, which is a great way to not answer the question, right? But sometimes people can be back to play 2 or 3 visits. Sometimes it can take months in reality. But maybe those months is you're exposing them to higher levels of movement or exercise and seeing how they do, and then kind of going backwards. So, for like chiropractor, most people think of spine. I do much more than just like low back pain, but I had a gentleman come in his 70s or 80s, and with low back pain, and at that age, getting them back to play, which for him, he walked and biked all the time,
Independence.
good of yeah,
That age,
like that's what he wants to do all the time. That could take maybe a week. And him, it's taken about a month with co-treatment with a physical therapist, right? And it just takes different time, but it can take 2 or 3 visits. It just depends. So in terms of minimum or maximum, amount to see them, again, it's what do they want to do? Or do they just care about getting better as fast as they can, or motivated to do whatever it takes? Or is it, they don't care that much, or it's going to take a while, because they also have these other comorbidities. You just got to really understand what's going on and set proper expectations, in my mind. So
Yeah, I think the expectations piece is huge, like you said. And I would, again, reiterate, like you said as well, Garrett, that every person and condition is obviously very different. So, it's not like I have a standard protocol of like low back pain is X visits or whatever. But I've had plenty of evaluations where people come in and they're like, hey, I tweaked something, or maybe I was hurt last week and now it feels a little bit better. I just want to get it checked out. And it's one session, and just let them know, yeah, things look great. They're good about just going back to the gym. Other people, they want a little bit more structure or guidance, whether or not they're in pain. A lot of times they feel like, yeah, it just helps to have somebody kind of in my corner. So can we, sort of customize the plan? And not to go on a diatribe about insurance, but part of why I've kind of structured my practice out of network is that it allows us to kind of break free of a lot of the restrictions of insurance tends to bring, where maybe somebody would benefit from a little bit more care or more visits, and but sometimes they get restrictions where they can't do that even if they want that. And so in this setting, it's pretty much up to them. Not that you say like, okay, you pick, and then I don't help at all. But we can definitely like stretch it out over time, so it turns more into like just rehab, and now it's more like performance based. So how do we not just get you out of pain, but maximize your strength and function to keep that away, type thing.
Biomechanics is a crazy thing.
Yeah.
It is. You can't put a timeline on anything. It's right. Like some people, it takes 5 years to be able to do an unassisted pull-up by themselves. Mm-hmm. Some it takes 2 weeks. Right? Like everybody's different.
you're still working on that, right?
Yeah.
Unassisted pull-up right now.
Yeah. It's been a couple years, but
It's been a couple weeks since you've been able to do one.
okay. Well, let's
Just
go back.
daggers. Let's go.
You try it.
Let's go back to why you were covering. How about that? All right.
The bar's right. Yeah, we can figure it out right now. Let's go. Let's see. 100 pull-ups for time.
Every time. Get the 50-pound vest out.
On the docket. It's coming up.
So not this Saturday, but the following Saturday, we're hosting a blood drive at Chiropractic Company. We're going to get a nice big pink bus. For those who enter in, you can win a Yeti cooler, which is really cool. But the summertime for blood drives, blood donations is really hard. Teachers and schools are closed. People are on vacation, so they don't get as much actual donations as they normally do throughout the year. So this is a really hard time for the demand, for whether it be trauma patients, cancer patients, anyone that needs other blood transfusions. So we're really excited to host it at the office on June 28th.
What group are you going with?
Versatility.
Yeah, we had them here we'll probably do that again.
Okay.
So, gotta help out the community in which way.
That's exactly right.
You can sign up online or?
Sign up online, yep. Sign up online, QR codes, maybe I'll send you a link as we
Yeah.
post this or whatever, to
That'd be
do
awesome.
it that way. Limited spots, limited availability, almost full, but it's like
That's
8
awesome.
to noon, so,
Cool.
yeah.
Cool.
Yeah. What about,
And for the gym, bring a friend week. So tell your friends, tell your homies that are interested in possibly coming to try a class. And if they sign up via the link that I sent out to everybody, and I'll post it on the YouTube page with this one as well. We can actually do that. That'll be easy. And then everybody can just find it in the link in the bottom
And
for all three.
What if Garrett has no friends?
Oh, then he just tells anybody at his office that's willing to try a class.
if I have no
Hey,
friends, I'm gonna go to the
hey,
grocery store.
They can also come
Preach process.
more than once. Come Monday, Tuesday, Wednesday, Thursday, Friday. Any day, that works
And
best.
people that have done Bring a Friend Week in the past can try again?
If they did not sign up, yes,
Okay, excellent.
absolutely. So, as for that, before we wrap it up, oh, we also have Storm the Bastille going down in Milwaukee. That's that 5K race that everybody does in the community. So that's organized by our group here. They do just a crew that goes down there together and runs it. It starts at 9 o'clock.
It's
Kinda a little late
nighttime
for me.
5K.
Yeah, right, yeah.
Yeah.
Heard it's a good time.
I've also heard it's a good time.
So check it out. Outside of that, next month we're going to be dropping a podcast and we're going to be talking with some of the ladies that we've worked with. I've worked with personally. They might have. And we're going to be talking about how pregnancy, postpartum, and obviously building up and fitness, as well as chiropractic and physical therapy, will aid in that stuff. So,
That sounds fun. I want to watch that.
yeah.
Oh,
You're going to be talking.
Oh.
Yeah. So that'll be it.
But we have to be there?
Yeah, we have to be there. We're going to have a huge group of people.
God, okay, I'll show up.
But,
Cool.
Nice.
yeah.
All right.
We're ready.